years of experience in substance use disorder. Dr. Jones is a veteran therapist, prevention specialist, workshop presenter, trainer, and administrator. He received his initial training from the Detroit Institute of Addiction Research and Training, and thereafter obtained a BA from Wayne State University, a Master's of Social Work from the University of Michigan, and a PhD in Human Services. His dissertation research topic was spirituality as a positive predictor of coping with stress for people in recovery from alcohol and other drug addiction. He is also a graduate of the Detroit Chambers Leadership Program, and he has developed and facilitated hundreds of workshops and presentations for thousands of attendees. So I present to you Dr. Jones.
So, my presentation is over. I hope you enjoyed it. It's now time for discussion. I was trying to figure out how I got to be so fortunate to be the only one on the panel with a tie. Thank you, Marcellus, and I appreciate the invitation to be here. What I noticed as the presentations were going forward and as the day progressed, that all the material that I had identified and things that I was going to talk about were being covered by other folks. That's what happens when you last. I have to remember that. I want to be first. That way everybody else can adjust their presentations. But I think since the time really has gotten away from us, and you know, I feel like you've gotten a lot of information, that I thought that we would just kind of prepare you for the next segment in terms of getting ready to come up with some solutions. First of all, as he indicated, I'm with the National Council on Alcoholism and Drug Dependence, Greater Detroit area, and the agency has been around for more than 65 years. I was not the founder. I didn't start the agency, right? I came to it later on in life. One of the coalitions that we're engaged in and we're happy to be involved with is the Coalition for Healthy Youth and Families. And some of those coalition members are here today. See Al Keeblan, the Safety Program, STEPS, Center for Urban Youth, and this, I don't see Milestone organization. And this coalition has been supported by the Institute for Population Health. Yay, Kara and Angie. Yes. And so we come at this issue with a load of experience, and I didn't mention Mac Alive as well, with a lot of things that we have been trying to do with the youth. And in particular, our focus has been in trying to train youth to be peer specialists or to do informal peer intervention. So we believe that if we're giving the youth the right information, that informally they share information, and that's what really happens. Actually, I think it's important that they adopt the information themselves and they believe it, and then they will share it. Instead of giving them the title and a responsibility, just look for them to do the job naturally. Let them just, they would naturally gravitate to the job. So that's why we really support efforts that really educate youth about prescription drug use. We do that through our Celebrating Families program. We do it through the program we mentioned earlier that received the award, the STEPS program, where the youth are doing media and technology-based initiatives, as well as our safety program. And really we have been looking at developing an app, a software app that can be applied in with many different issues, such as prescription drug use. We think that it's important to do that. We also, as many have already said, believe that we've got to educate parents. And one of the real challenges, and I hope we can come up with some suggestions on how to deal with this. The challenge is, once again, that there is a low perception of risk. So how do we increase the perception of risk? Because we know that if we can increase the perception of risk, that you reduce the use. And so we certainly need to come up with some strategies, some methodologies and interventions to address that issue. Other issues